Everybody, I know it's been a while since we've done one of these because it's kind of hard for me to do it here. I am in the Rehab Center. It's Gateway in Lenore, and technically they don't allow me personally to record myself, so somebody else is doing it, so technically it's okay. The physical therapists here are very nice, and the certified nursing assistants and the nurses are very sweet. They're very good people, and they try very hard to make their patients and residents feel very good. We are having some issues though. The upper management has decided that my service dog is not allowed to stay in the building. She's allowed to visit for a couple of hours, but she's not allowed to stay. So they had sent her home on my second day here after a lot of arguing about whether or not they were legally allowed to send her away or not. We lost the argument and they sent her home. So she visits on occasion, but she's not allowed to stay. Since she left, I have had at least one seizure almost every single day. There's been several days where I've had two, including falling out of my wheelchair at one point and having the wheelchair fall on top of me. Yesterday I fell out of the bed and had to be rushed to the hospital for a head CT and an x-ray of my shoulder. In this lighting you probably can't tell, but I have some bruising on my face around my eye socket because I hit my eye socket on the floor, and they said I had orbital bruising and will probably be dealing with headaches and blurry vision for a few days, which I am. I also hit my right shoulder on the floor. Probably when I tumbled off the bed, they're saying that they're pretty sure that all of my weight came down on that shoulder, which is not a good thing since that's the shoulder that earlier in the year I had to have repaired because I, of course, injured it in a fall due to a seizure earlier. And they said that they didn't find any bone damage, but the doctor at the hospital was concerned about soft tissue damage, so I'll be calling my
Ortho.
Thank you. My orthopedic surgeon to have him check for soft tissue damage or a repeated tear in his repair, which would really be bad, because she was concerned about damage in that area and suggested that I call him right away and try and get in and have that looked at. Because, of course, I have no warning when I'm going to have a seizure. I have no idea in advance, so I can't call for help or anything like that. And my warning is my dog. Now, I have family visiting today, and they brought the dog up to see me. And I did have a seizure while they were here visiting today. And, of course, the dog went off. She alerted. She got that intense look, something's going on. She crawled up me. And just as the seizure started, I'm assuming that
She held you down.
Yep, that she did her thing. She will, if I'm in a laying position, she will climb up and lay on me so that I can't roll off of something or that kind of thing. When I woke up, she was, of course, licking my face, which is her job. She wakes me up from my seizure. So I hugged her and I petted her and I gave her her good job treat. And then she immediately crawled to the end of the bed and went to sleep, which tells me that she is peaceful and we're fine. If you want to have a peek, she's at the end of the bed. See, there she is. All nice and calm and happy.
And she wasn't like that.
Yeah, she wasn't like that until after I had my seizure. She was up, she was alert, she was sitting on my hips and paying close attention to me. Now, at first it was because she was just really happy to see me. And then it was, you could tell by her face that something was going on. She was very intense. She kept looking at me. She kept looking at my mom. You know, something was up, and we knew it. And sure enough, there goes the seizure. And then I get up, and now she's at the end of the bed. She's relaxed. Everything's normal. And the upside is that if I can see that she's at peace, I'm calm. And this is probably the calmest I've been since she left on Friday. Because I can look at her and know, okay, I'm good. No big deal.
Mm-hmm.
So, you know, it's a give and take. Plus, she's been having some problems being at home. I guess she has gotten a little depressed, would be the word for it. She is very lethargic. She lays in front of the front door and just sits there and stares at the front door.
Mm-hmm.
And that's not a good thing. She's unhappy. They're trying to get her up and around. Mom's offered to have her lay on her bed with her, but she won't stay. They try and get her in her vest and take her for walks and even take her out places, but she's not being responsive.
She's even antsy about that because when I take her into Walmart stores or something, she's constantly looking for Renee.
So she's having a little trouble adjusting to where's mommy, because she knows she's supposed to be around me. So we're both dealing very badly with the separation thing, but we're trying. The physical therapy itself is going okay. They come in the morning, and then in the late afternoon they come in around 10, and then they come in around 2, and they work with my legs. And then I have an occupational therapist who comes in. She comes in at any point during the day. I've had her as early as 9 and as late as 8 o'clock in the evening. Just depends on when she can get in the room. But she's working on getting the grip back in my hands and the strength back in my arms and things. And she's been really good about working with me and that kind of thing. So the rehab part is, they're trying really hard. And most of the nurses and nursing assistants that are working here are very good people, and they try really hard. It's more the upper management that we're having some issues with. Issues would be a good word for it. There's been some pulling back and forth as we're trying to figure out exactly what is the rules in North Carolina regarding service dogs and a place like this. So I'll keep you posted on that, and have a good day.